as we develop themes throughout the weekend, you're going to feel more comfortable talking about health and nutrition. You're going to feel more comfortable overcoming obstacles in that practice, answering questions about things like literature, studies, why would I even recommend supplements to my patients, those sorts of things. So I want to start with this idea of the meaning of essential. I want you guys to know that essential in the case of nutrition means necessary for life. It's not kind of important, it's essential for survival. There are nutrients in the body that are also referred to as essential. Essential nutrients cannot be manufactured, they cannot be synthesized. They have to be eaten or consumed. So if you can't make it, you need to take it. How many people agree that we have a rising obesity epidemic in the United States? That we have more and more people becoming sedentary or feeling like sedentary lifestyles are a normal lifestyle, right? We're starting to see an incline, not a decline, in chronic disease. For these reasons alone, we need to consider getting back to basics and thinking about the foundations of well-being, the foundations of physiology, the foundations of health. And that means talking about essential nutrients, about making sure that you're getting essential nutrients. So my first goal for you in going through this portion of the weekend is to answer this question for yourself. Why do health professionals need to consider talking about health and nutrition, wellness, or supplementation with their patients? My answer will not be your answer, but I'm going to share with you why I think practitioners like myself, practitioners that are in conventional medicine, need to be looking at this, not just those that focus in holistic health or integrative medicine. One rule I want you guys to embrace, or one idea I want you to embrace, is the idea that we are a nation of wealth. We are not a nation of health. We are a nation that traded our health for our wealth. And there are multiple things that have contributed to this poor well-being or this decline in health. And it is poor nutrient choices. It is the fact that many people today get their food out of a window, right? Today we have to think about those sedentary lifestyles and the rising challenges that we see in cardiovascular disease, type 2 diabetes, risk factors for cancer and osteoporosis. All of them are linked to poor lifestyle. There are 3 common threads in disease. Oxidative stress leads to chronic inflammation. Chronic inflammation leads to hormone disruption or dysregulation. Now we know oxidative stress as things like immune dysfunction. We know things about oxidative stress, or we think of oxidative stress as premature aging, cardiovascular disease. We think of chronic inflammation as things like joint discomfort, fatigue, aging, right? And then this hormone disruption, we think of things like menopause, cardiovascular disease, type 2 diabetes. They all are linked to 4 threads that you can talk about. We do not get enough sleep. We are overly stressed, suboptimal food choices, and sedentary lifestyles. Those are the 4 S's that lead to those 3 common threads. Now, one of the things I want to be open about is that you do not have to know what I know to be successful in Nutrametrix. You do not have to answer the questions about disease and treatment, mechanism of action, to be successful in Nutrametrix in the practitioner's office. You need to be able to speak in themes. The first theme I want to make sure you guys feel comfortable with is just that. The idea of essential nutrients. If you can't make it, you need to take it. A lack of these essential nutrients contribute to the things that we treat in disease or in medical practices every day, like heart disease, like type 2 diabetes, like osteoporosis, immune dysfunction. When we think about this, you can simply share this line. There is an intimate link between a healthy diet, doctor, including supplementation and a decline in chronic diseases. I want to share it with you again. There is an intimate link between a healthy diet, including supplementation, exercise, sleep, and a reduction in chronic disease. That is not negotiable. That is not debatable. That is proven that when you commit at a higher level to better sleep, better diet, better movement, you can see a decline in chronic disease. And that's the number one reason why we need to think about talking about wellness in our practice. Because quite frankly, and this is the way I like to do it, I like to just flip my hip out, put my hands on my hips, shake my finger, right? And say, doctor, I think you and I can agree. And I think this is a good idea. I learned this from my friend Jim Dwyer, where we start talking about the likenesses between us. We start talking about the things that make us on the same side, the same page, right? Let's stop talking about our differences and start talking about the things that make us like each other. Doctor, you and I both agree, and this movement allows us to say we are in this together, right? You and I both agree we want what's best for your patients. You know you want to see results, and your patients want alternatives. Today, in medicine, the pendulum has swung. Today, we don't see people looking for medication. Today, we don't see people looking for easy way outs necessarily. More and more of your patients today, doctor, are asking questions about what they can do to stay well, to be well, to sleep better, have more energy, age better. These are all questions that you need to be able to answer in the practice. I don't mean you answer in the practice. I mean the practitioner needs to be able to answer in the practice. If that pendulum is swinging towards complementary and alternative health, Nutrametrix is the answer. Through TLS weight loss, right? Through customized nutrition, through nutrigenomic analysis. But I want you guys to start with the easy button. Essential nutrients. Nutrients that you can't make, so you need to take. Because doctor, quite frankly, systematically treating disease without assessing the patient's lifestyle or offering guidance on how to change their lifestyle is irresponsible. It borders on neglect. Now, I don't think you're going to win any friends or influence people by telling a practitioner that they are neglecting the needs of their patient. That's why I want you to go back to what Jim Dwyer taught me about talking about our similarities, not our differences. But you need to believe this. And when I say believe this, I don't mean from here. I mean from here. You need to believe that doing anything short of changing the way people eat, changing the way people supplement, changing the way people manage their stress and support their sleep, anything short of that is neglect. It's irresponsible. You guys have a mission. Woo! Right? So these are the kind of things I want you to speak with passion and belief about what we're doing with Nutrametrix. When it comes to what we can do, how we can change their well-being, that we want to think about how do we change systems in their practice. Can you, Sarah, will you move it to the next slide? Here we go. Assisting patients towards better health. Now, this doesn't just work for the health of that practice or the facility. It works with how you decide to change and motivate behavior when it comes to the practitioner as well. So I want you to think about this slide not just as how they're going to speak to their patient, but also how you're going to successfully implement in the practice. In the practice, whether you are the Nutrametrix consultant or you are the practitioner or a staff member working with the patient, you need to offer clear direction. What do I need you to do? How often do I need you to do it? What are we going to do? How are we going to measure when we check in with each other to see are we better, worse, the same? To create that habit, you need to talk about clear direction and move it into ways to motivate. Now, motivate who? We've got to think about ways that we motivate the staff. We've got to think about ways that we motivate the patient towards lifestyle changes. We need to think about how do we motivate the practitioner into utilizing tools that we make available through Nutrametrix. How do we motivate them to bring it up? How do we motivate the practitioner to follow up? These are the systems and the themes that we will talk about throughout the weekend. And we want to make sure that we create Again, whether it is for the facility and the staff, whether it's between the practitioner and the patient, or between the facility and the Nutrametrix consultant, what does a supportive environment look like? These are the answers or the questions that you need to find answers for. And here's the bad news. The answers to each one of these will change depending on the practice that you're working with, the volume of patients that they see, and how much time they can dedicate to a wellness program. For that reason, I want you guys to learn, more important than anything you learn this weekend, I want you to learn how to bob and weave. I want you to learn how to be creative in your solutions. I want you to look at each one of these themes and develop your own script for how to dialogue. Because if you just learn what Sarah DeGender says, if you just learn what Dr. Mason says, if you just learn what Brandy Murphy says, at the point that a question gets asked that we didn't cover, you will not be able to what? You will not bob and you will not weave. You will stand there like a deer in the headlights. I don't want that for anybody. No deers allowed. Okay. So when we think about this, these are some of the ways I find it easy to bring up the importance of supplementation and why supplementation is relevant in the practice. I may say something like this. Doctor, as I'm sure you can agree, many patients do not consume a healthful diet. They're not getting the 5, 8, 12 servings of colorful foods a day. For that reason, the simple intervention of a multivitamin may fill in gaps where their diet falls short. I may say something like, Doctor, I'm sure you can agree. And again, we're talking about our similarities, not the things that separate us. Doctor, I'm sure you can agree that more and more practitioners are doing vitamin D testing. More and more patients want to know, should they be taking a vitamin D supplement? I've never met someone that is vitamin D sufficient that isn't already taking a vitamin D supplement. Considering that every one of your cells has a vitamin D receptor on it, we now can appreciate that vitamin D can change the way every cell behaves for the better. And for that reason, you may want to consider recommending vitamin D here in the practice. I may say something like vitamins and minerals are essential for life. It means that our body can't make it or synthesize it. If you can't make it, you need to take it. And then I run back to point number 1. The simple intervention of multivitamin can fill in gaps where a patient's diet falls short. I may say something like bad gut bugs don't take a day off, so why should good gut bugs take a day off? Taking a probiotic has been linked to overall health and well-being, whether it is cardiovascular health, whether it is mental, emotional health and well-being, whether it is a healthy waistline. Your microbiome or your gut bugs having a healthy digestive tract has been implicated in changing disease behaviors in all different tissues of the body. For this reason, doctor, we should get started with, at the very least, a probiotic in the practice. Now, what I want you guys to hear from this is I'm not saying hit them with a multivitamin, then hit them with vitamin D, and then hit them with essential vitamins like B complex. And then you want to make sure they get that probiotic. Yeah, is that the goal at some point? To start getting more and more real estate on their shelves? Absolutely. But one of these things that you talk about is going to light them up. One of these things that they're going to be like, you're right. I do a lot of vitamin D testing in the practice. Great, what are you currently recommending? Well, I recommend that they go down the street. We can change that for you, doctor. We can help recapture wellness dollars that are being spent outside of your practice and ensure that they get spent inside your practice, right? That's our goal. That's our mission with Nutrametrix, is to help improve the financial status of a practice, to help improve the well-being or results within a facility by simply doing that. Recapturing wellness dollars that are already being spent outside of your practice and ensure that they're being spent inside the practice. When we think about supplementation or the reason for a wellness program, this one makes sense to everybody. This idea that as we age, our body's metabolism changes. our micronutrient needs change, demands change. And for that reason, supplementation may be one of the more cost-effective things you do to slow down the progression of disease, right? Now, the message I want you to get from these last few slides is that I didn't talk about disease, I didn't talk about treatment, and I didn't talk about cure. I talked about a universal rule. Everybody requires micronutrients. Everybody needs B vitamins. Everybody needs vitamin D. There are benefits to taking probiotics, whether your complaint is sleep, cardiovascular health, obesity, or digestive needs. Right? So I don't want anybody leaving here thinking that they need to know how to treat or that they're even going to make those kinds of recommendations. I want you guys to hit that universal law or that universal that equalizer. People know what to do, but they don't do it. As we age, our demands change. And for that reason, our supplement schedule, our dietary schedule, our sleep schedule, and our exercise schedule needs to change with us. If we want to come from horizontal and move back up to vertical, we need to have a higher commitment to supplementation. But these are all emotional arguments. What are you going to run into? And you're going to run into it. Practices that say, show me the numbers. Practices that say, I want to see the evidence, right? These are all well and good from an emotional standpoint, but I want to know what happens. Can we change, maybe get a new battery in this and have you, there we go. So that would be awesome. So let's look at the numbers. What do the numbers say? Greater than 70 Americans today currently live with cardiovascular disease. Roughly 50% of them are doing this, keeping their blood pressure at goal by using pharmaceuticals. I want you to ask these types of questions. Doctor, what are you currently recommending for the other 50%? Doctor, what do you currently do for patients that you see that don't, thank you, Jim, that don't meet the needs or don't have a requirement for a surgical intervention or a pharmaceutical intervention? What are you doing to keep them at goal before they need a more aggressive therapy, before they need a more aggressive approach? Something as simple as that can get a practitioner to stop and go, you're right. Like, lifestyle is implicated in chronic disease. What am I currently doing to keep my patients that don't require pharmaceuticals healthy? My goal here is to get the practitioner, to help you get the practitioner to say, you're right. I mean, currently, up until this point, what I've done is I said, well, you're not a diabetic, but you're well on your way. Maybe by next time I can write you a prescription, right? Instead, let's get our practitioners to start saying things like, you're not a diabetic, but you're well on your way. I want you to go ahead and get started with botanicals and supplements that can support your blood sugars, keeping them within a healthy range so that I don't need to write you a prescription. Let's start getting our practitioners to start thinking about dialoguing with their patients about the fact that while 50% of their patient population may require a pharmaceutical intervention, there are things that we can do through diet and lifestyle and supplementation that can stop the progression of disease to the point that I may not have to recommend another pharmaceutical. I may not have to recommend a higher dose of a pharmaceutical or more frequent dosing of a pharmaceutical. These are the things that supplements can do for the medical practice. These are the things that supplementation can do for the allied health professional that doesn't prescribe medication but wants to help their patients stay at goal. You just need to be able to bob and weave to answer these questions. Sedentary lifestyles are definitely a problem today. And the point that we want to get across is the fact that sedentary lifestyles are an artifact of our computers, of our cell phones, of our remote controls, right? Today we have lifestyles that keep us in cubicles, that keep us tethered to our technology. And for that reason, we're not getting up and moving around enough. So the problem here is that not every so often, practitioners only think about talking about obesity and lifestyle and dietary intervention when the person in front of them is obese. When the person in front of them has an obesity-related disease, like cardiovascular disease or type 2 diabetes. Which means that there's a huge population that we're missing where we could talk to them about well-being, about how to stay healthy, how to support in our techie world, how to support healthy body composition. It allows you to go into a conversation that isn't pushing or swimming upstream, a conversation about TLS, right? Because we're now talking about things that are very relevant to their practice. If I could give you another tip on how to work with practitioners, it would be to talk about things that are relevant to their practice, not esoteric. Listen, OPC3 is brilliant, but it's also a novel concept to most practitioners. You know what is not novel? You know what is something that they do every day? Talk to people about weight, or needing to be healthier when it comes to weight, or how obesity is a risk factor for disease. So your opening statement may include the fact that we have services that support healthy weight, that also generate additional income for the practice, right? I want you guys to think about those things that are relevant. That's why I bring up vitamin D, right? That's why I bring up things like essential nutrients. These are concepts that practitioners won't have an emotional reaction to. They already know that calcium is highly recommended in a postmenopausal female. So we're not asking them to do anything that they don't already know. We're just asking them to recapture wellness dollars that are being spent outside of their practice and make sure that they get spent inside their practice. There's probably no better example of this than vitamin D. What you're looking at here is a map of those of us that are vitamin D sufficient. Greenland is vitamin D sufficient. The rest of us, forget about it, right? That means that every one of us could be benefited by vitamin D supplementation. And that's why I like to bring that up. I've never met someone that is vitamin D sufficient that doesn't already take a vitamin D supplement. Considering that every one of your cells has a vitamin D receptor on it, vitamin D supplementation may be the single most cost-effective thing you do to support your overall well-being. Now, I say that with belief, I say that with posture. That's what I want you guys to get out of this weekend. It's how to repeat your own script so the practitioner says that makes a lot of sense. I think I could do that. I think I could share that information with someone. One way to talk about vitamin D supplementation and the need for it is the fact that our richest sources of vitamin D are things that people don't consume on a regular basis or consume enough. So if they're not eating fish on a daily basis, or at least 3 or 4 times a week, there's a chance that they will be vitamin D insufficient. They also will be omega-3 insufficient. I've now just parlayed a conversation about people's dietary habits into the need for supplementation with vitamin D, and should they be willing to listen, the need for omega-3 supplementation. Because by talking about our similarities, I've managed to get that practitioner to agree. Patients know what to do, but they don't do it. Patients know what good foods are, like healthy fish, but they don't eat them. Therefore, they need to have a higher commitment to supplementation. If you're not getting it through diet, then you need to be getting it through supplementation. And vitamin D may be the single most cost-effective thing you do to support your overall well-being. When we look at disease factors, I know that the numbers can speak volumes. When we look at those that have elevated risk factors for cardiovascular disease, joint dysfunction, immune dysfunction, we can measure inflammatory end products. Well, the evidence is very clear that those that have heightened inflammatory factors, here measured by C-reactive protein, also have poor or poorer micronutrient status than those that do not have chronic signs of inflammation. We see lower B vitamin status, lower iron status, right? We see lower vitamin A status in these individuals. Now, the question you need to be able, not be able to answer, but I want you to be able to bring up is, doctor, we don't know if people with chronic disease simply run through their vitamins quicker and therefore need to supplement, or those people that don't supplement are have poor micronutrient status and therefore are at higher risk for inflammation. You see, it doesn't matter which side of the coin you want to stand on or what side of the fence you want to stand on. What is the solution? Supplementation, right? So these are the types of conversations where you get the doctor or the health professional to be like, you're right, that makes total sense, right? And nowhere in the last 20, 30 minutes have I said, here's the treatment or the protocol for cardiovascular disease or type 2 diabetes. I simply spoke on what can you do for every one of your patients. You can improve their micronutrient status because it changes their risk factor for chronic disease and inflammation. We know that individuals that do consume dietary supplements have higher rates of vitamin D or vitamin status. Not just lower indices of inflammation, but more vitality. Individuals that report that they are supplement users also report that they have better dietary habits, that they have better exercise habits, that they have better sleep and sex habits. These are people that would rate themselves at a higher quality of life. That's the other thing I want you to get from this section, quality of life. The thing that vitamin supplementation, nutrient or botanical supplementation can do for a wellness program or a wellness initiative in a practice is improve quality of life for the patients that partake. We do find that individuals that are supplement takers rate their quality of life higher. They rate their sex life higher. They rate their energy levels higher than those that are not supplement takers. The message that you can take from this is that small changes, like a multivitamin taken every day, can lead to greater changes in lifestyle. Starting today with a multivitamin to fill in gaps where your diet falls short can start to lead to better sleep habits, stress reduction, better social interaction, right? Better health, better energy, better quality of life. We know that there are individuals that will fare poorer and therefore have to increase their commitment to supplementation. People that are overweight do not absorb nutrients as well, and as a result, will have poor micronutrient status, have poor levels of these micronutrients in their blood, and therefore less bioactivity to allow nutrients to change their insulin factors, to change their health factors, inflammatory factors. And so it's for these individuals, doctor, that you may want to consider talking about lifestyle changes, starting with a multivitamin, starting with vitamin D, starting with omega-3 fatty acids. You see, it doesn't have to be all of them. You just need to get started. And you're going to find, by working with the practitioners, you're going to identify that one product that they need to start recommending today. Now, we do know there are aspects of well-being, and well-being starts with early education. When we think about children's health and this incline of chronic disease, cardiovascular disease, blood sugar issues, and obesity in children, it may be worth talking about this theme from that perspective. When we think about essential nutrients, we know that from an academic performance, a physical performance, a social performance, children may underperform if they have poor micronutrient status. And so for this reason, it would be worthwhile to start talking about changing lifestyle habits around the dinner table. A good start is to start talking about the importance of essential nutrients. When we think about this, I also want practitioners to understand and you to share with them that in the absence of chronic disease, in the absence of being overweight or poor diet, in the absence of physical activity, in the absence of things that we think of as pronounced disease, physical inactivity is a major player in disease, right? I want us to think about how we can start talking about wellness factors in that practice. It's all adding up. When someone asks about the numbers, it's all adding up. The indirect costs of cardiovascular disease outweigh those of major health concerns like cancer. The combination of many other chronic diseases, or the dollars spent on other chronic diseases, don't meet anywhere near the numbers or dollars that are spent on cardiovascular disease. Now, while those may be the numbers, it may sound like wah, wah, right? Those may be the numbers that this many people are going around untreated and they have high blood pressure. This many people are going around gaining weight and becoming cardiovascular nightmares because of their sedentary lifestyle. That's actually not what I want you to focus on. What I want you to do is simply talk about those numbers in a way that says there is a real problem in front of us, but talk about the flip side. This is where I want you to bring the practitioner. The idea that the American Heart Association, the American College of Cardiology, all agree that diet, including supplementation, can change cardiovascular disease risk factors, can change type 2 diabetes risk factors. That a diet that is low in oxidized fat, but high in healthy fats found in their natural state can be beneficial in the care of cardiovascular disease. So it comes down to breaking myths. It's not about low fat. It's not about no fat. It's about choosing the right fat, right? That there are ways that we can start to break these myths with our patient's doctor and change their cardiovascular disease, change their trend towards type 2 diabetes or obesity, simply by having a conversation about what are you doing when you go home to eat well. A good start to filling gaps where your diet falls short is to get started with supplementation. That may be a multivitamin, that may be an omega-3 fatty acid, that may be vitamin D. Those are things that you're going to figure out with the practitioner. The flip side, when we think about overweight patients with type 2 diabetes that are assigned exercise and dietary intake, dietary counseling, we find that the costs of treating the diabetic go way, way down. We don't just see a decrease in hospitalizations, but also a decrease in length of stay. We are improving the way healthcare dollars are spent by getting started with a discussion about preventive health, right? When we think about the impact on the economy, I do want practitioners to know, unfortunately, we have to have this conversation because sometimes consultants will come back to us and share that physicians are worried about implementing a wellness program because that takes away patient visits or office visits. So you should know that individuals that participate in wellness programs within practitioners' offices don't see their physicians less often. They just respond better to care, they go to the hospital less, and they cost these capitated healthcare plans or these insurance plans less. And as a result, the practice benefits. As a result, the practice's wellness scores through the insurance companies go up. These patients didn't see their practitioner less. They just got different lifestyle counseling when they saw their practitioner, and as a result, their length of stay went down. Their admission to hospitals went down. Their response to care went up. The results that we were looking to achieve, like getting patients to goal with their blood sugars, their blood pressure, their cholesterol, we were able to meet them better. So it's important for us to know that there is an intimate link between the counseling that comes from that practice and the recommendation and the follow-through of supplementation, right? When we think about U.S. nutrition policy, this is where a lot of us are coming from. We think about myhealth.gov. What types of foods or what composition of foods should I be putting on my plate? How do I divide up my plate, and what types of foods should I be choosing? This is what I want you to get from that. All good guidelines, but they do not take into consideration a patient's family history. They do not take into consideration a patient's behavior, right? Whether they get good sleep or they manage their stress or they're not doing any of that. right? They do not take into consideration what's referred to as scarcity of resources. Do you have access to good food? Do you have access to playgrounds or a place where you can get out and breathe fresh air? Scarcity of resources are not taken care of when it comes to these plans for healthy eating, right? That means that we as practitioners, or you as coaches to the practitioner, need to be able to open up a discussion about that. The most important discussion to open up, or the most important topic to open up with in that discussion, is the idea of adherence. Patients know what to do, but they don't do it. Ask anybody if they know that they're supposed to get dark green leafy vegetables, eat fat in its natural state, make sure they get plenty of protein, versus getting their food out of a window. They know what to do, but they don't do it, right? So we have to think about that. We have to think about adherence. And many individuals are looking for the easy button. Many individuals are looking for something, what do I do, doc, when I leave here? We need to make sure that practitioners start sharing the importance of getting good sleep. And if you don't get good sleep, supplementation can help you achieve it. You need to lose weight, and if you don't know how to do that, things like weight management and weight management through TLS and supplementation can help you do that. The easy button for so many of these practices is supplementation. The easy button for so many of these practitioners in increasing adherence with their patients is Nutrametrix and the services and products that we provide, because they fill in gaps where a patient's diet falls short. They're nutrients and botanicals that repair metabolism. Small steps lead to big changes. So just getting started with supplementation starts to put people in a trend towards better sleep, better exercise, better dietary habits, and then sharing that information with their families, and then families share information with their communities. This is how you start a movement, right? This is how this health revolution begins, by getting the practitioner to say this is relevant. And they don't know it's relevant until you walk in there and throw your hip out, put your hands on your hips and say, I want to talk to you about Nutrametrix. Right? What I want you to take from this slide here doesn't have to be this idea of recommended daily intakes. What I want you guys really to take from this slide are these things. That our needs as we age change, and that what is recommended through dietary intake is a minimum mindset. It is the minimum amounts necessary to stave off disease, things like rickets. But it makes no claim about optimal well-being or the type of dietary intake you should be, your dietary intake through different decades of life or different health challenges. Right, so supplementation is the solution. I want you guys to understand that the body triages its nutrients. If you're not getting a lot of nutrients, then your body will hold on to, will use those nutrients only for supporting like your cardiovascular system, but will let other things fall to the wayside. It's called the triage theory. Right? And this is where chronic joint discomfort comes from. This is where sleep issues come from, because there aren't enough nutrients in the body to meet all of those metabolic needs. So the body is literally hoarding those nutrients just for its life-saving requirements, like pumping blood through the body, right? So it allows you to have a foggy brain. It allows you in that triage situation to gain weight around the middle, have poor sleep, or let your skin go to hell, right? Because nobody dies of being ugly. They die of their heart stopping to function, right? So your body lets the other stuff go, right? I want you guys to know that. The third thing I want you to take from this is that common sense isn't always common practice. People know what to do, but they don't do it. They want guidance. The practitioners that you work with want guidance. Their patients want guidance. I'm not going to go as far as to say they want to be told what to do, but they want to be told what to do. Right? So that's where you come in. They don't know what a Nutrametrix implementation looks like. So you're going to share with them, with a simple intervention of a multivitamin, multimineral doctor, an antioxidant, and an omega-3 fatty acid. We're going to cover 80% of your patient's needs, and we're going to start recommending these to everybody.
Okay.
Right? When we think about dietary guidelines, we have improved in many of the recommendations. I bring this up simply so that you know you are not swimming upstream. More and more practitioners feel better equipped to talk about the need for healthy nutrition, but they still don't know what to recommend, right? When we think about where dietary guidelines have fallen short, it comes down to being able to, it comes down to helping the practitioner identify that while people have been told to increase their vitamin intake through colorful vegetables, they're not doing it, right? When it comes to increasing fiber, they're not doing it. And so supplementation is a way for us to get people started on the right track. And again, I'm going to repeat this. You don't have to know everything that I know, everything that an experienced Nutrametrix consultant knows with a lot of their practice, because they have a lot of experience with their practices. You need to find easy ways to dialogue about the importance of supplementation. You can simply start with, Doctor, as you know, patients need to be consuming healthier diets. They need to be looking towards weight management programs or increasing their physical activity and managing their stress. You may want to just share with them, when it comes to eating healthfully, it's really quite simple. If it's lean and green and colorful, you can eat it. If you couldn't put it in your mouth 100 years ago, don't put it in your mouth today, unless it's coffee, because coffee is delicious. If your food has a long shelf life, you will have a short shelf life. If you have to ask yourself for permission, then the answer is no. Right? So we do have some benefits when it comes to dietary guidelines. Today, in 2015, the dietary guidelines revealed that practitioners need to start talking more about modifiable health factors or risk factors for disease. They need to start talking about sleep and behavior, stress, and scarcity of resources. So I want you to know there's a lot of support for what we do with Nutrametrix today. More and more government bodies are saying this is a conversation that practitioners need to start having with their patients. They need to start talking about overweight and obesity as risk factors for disease and the importance of healthy dietary intake, while also understanding that patients don't always adhere to dietary programs, dietary counseling, and for that reason, I'm going to come back to one of the first slides. There is an intimate link between the reduction of chronic disease and helpful dietary intake, including supplementation. Get started with supplementation as we try to change people's behaviors, right? Their sleep behaviors, their stress behaviors, and their eating behaviors. We can start talking about the importance of eating locally, and that one of the ways to filling gaps where a patient's diet falls short with a multivitamin is by recognizing that many of the nutrients or many of the foods that we consume today are not nutrient dense, they're calorically dense. And for that reason, we need to add in supplementation to support their metabolic needs. Often practitioners will ask you, who is recommending nutritional supplements, right? Well, you should know that there is a large population already consuming supplements. And so it's something I want you to share with practitioners. Doctor, it's not a matter of if patients will buy supplementation, they are already buying supplementation. They are already using these types of methods to stay healthy. Our goal with Nutrametrix is to recapture those wellness dollars and make sure that they are spent within your practice, because it's already a part of recommendations for you to counsel your patients about healthy lifestyle. It's already a part of the industry where nearly $40 billion has been spent on health and nutrition, supplementation, and weight loss. When we think about the fact that that dietary intake or what is recommended doesn't make any claim about optimal well-being, or that there are certain patient populations like smokers that need to have a higher commitment to supplementation because their own lifestyle, their dietary habits or their smoking habits have led to concerns in chronic disease, and so we need to increase the amount of vitamin C they take. We may choose to recommend antioxidants like astaxanthin because we don't recommend beta-carotene to smokers. So any practitioner that says, I can't recommend a multivitamin because it has beta-carotene, so you could definitely recommend astaxanthin. It's a fantastic antioxidant that isn't a problem in smokers or those where you're concerned about upper limits of antioxidants. See, there's always a way through through product education that you can find someone or find a solution when they say, I can't do this, and say, then I would like you to consider this. That's what I want you to get through the weekend, is how to bob and weave through those ideas, right? This idea that we already supplement. Share this with them. Because of food fortification, enrichment of the foods that we eat today, we already recognize the importance of supplementation. That's why we food fortify. That's why our foods are enriched. Because we recognize that B vitamins, things like vitamin D, calcium, all play an intimate role in changing disease. The absence of those things leads to disease, right? Does that make sense? Now here's the biggie. This comes up quite a bit. Well, what about all of that media hype out there that says multivitamins don't work or supplements aren't effective? Aren't supplements dangerous? Don't they cause harm? Case closed, right? I want to encourage you guys to read the articles. Look then at the source materials and make a decision for yourself, because this is actually what's going on. While these studies that are out there, indict supplementation as being problematic or ineffectual. So the first thing I want you guys to feel comfortable talking about is the fact that supplements are not drugs. That's the only thing that the literature has revealed, that they're not strong like drugs, they don't act fast like drugs, but also they don't have the side effects of drugs, okay? That's the first thing I want you guys to feel comfortable about. We're not talking about treating disease. We're talking about improving quality of life. We are talking about adding in a preventive measure so that we don't have to be aggressive with pharmaceuticals. But we don't have any expectations that supplementation will replace a pharmaceutical that they're already taking, because supplements don't act like drugs. So when the literature says they don't cure cancer, you need to feel comfortable saying, currently I don't believe we have a cure for cancer. So I'm not sure anything cures cancer right now, so let's not indict the multivitamin for not doing it, okay? When we think about when we think about the importance of supplementation, you want to ask this: in the absence of harm, knowing that supplementation leads to better food choices and dietary habits, is there any reason not to recommend a multivitamin, right? Instead of feeling like you're swimming upstream, having to come up with reasons to supplement, like essential nutrients, if you can't make it, you need to take it. An increase in type 2 diabetes and heart disease that has been shown to be lowered by supplementation, like omega-3 fatty acid use, B vitamin use. Instead of feeling like you need to get them on your side, simply ask the question, is there any reason not to be recommending a multivitamin, multimineral? When it comes to what's out there in the literature, you'll see headlines like this: multivitamins provide no benefit. When in fact, what the report said would be that sufficient evidence is not available to support recommendations for or against the use of multivitamin supplements in primary prevention, right? In fact, when that headline came out and said multivitamins provide no benefit, in fact, what they concluded was supplements containing combinations of certain nutrients may be beneficial in reducing the risk of some chronic diseases when used in special populations. And they cited postmenopausal women are benefited with calcium supplementation and vitamin D supplementation to stave off or stop the progression of osteoporosis. This is a study worth paying attention to. In 2002, a landmark study came out and said most individuals do not consume optimal amounts of nutrients a day. Practitioners don't know what foods to recommend, so a multivitamin is a prudent choice. They went as far as to say that people that have a higher intake of vitamins and antioxidants, whether it's through dietary intake or supplement, generally have lower risk of chronic disease, including myocardial infarction, a heart attack, or stroke. They concluded it does in fact appear from the data that a diet rich in vitamins is associated with a tendency to improved health, right? When we look at the American Dietetic Association, they now agree, they have a position paper stating that while healthy dietary choices are the cornerstone of well-being and dietetic philosophy, there is a role for supplementation in individuals that may be deficient in micronutrients or healthy dietary choices. And for that reason, it is prudent for all populations to look at supplementation. The American Heart Association recommends omega-3 fatty acids. Thousands of literature articles support omega-3 fatty acid utilization for cardiovascular health, for blood sugar health, for neurologic health, for bone and joint health, for longevity. So the literature is huge when it comes to supporting quality of life and risk factors for disease. We just don't make claims about treating, curing, or a disease, right? When we think about what experts in this field are saying, experts in medicine are saying, they're saying that lifestyle changes can be reframed not just as preventing chronic disease, but also in reversing the progression of those illnesses. When we think about who recommends supplements, we notice that individuals increase their supplement use as their age increases because their needs increase. We see certain patient populations are more likely to utilize supplementation because their patient population may be at higher risk for cardiovascular disease or type 2 diabetes. We know that women consume more nutrients through supplementation than men do. So these are the types of things that you want to identify in the practice. What does your patient demographic look like? Do you have a lot of women, right? Because they are supplement takers. Do you have a lot of Hispanic patient population? Because they are supplement takers. Do you have an older population with disposable income? Those people are supplement takers, right? You want to identify who those people are. More and more practitioners today are recommending supplements. 31% of patients say that they take their supplements because a nurse recommended them. Almost 50% of patients today report that the reason why they supplement is because their physician recommended that they do it. Why would you talk about health and nutrition, a wellness program, or simple supplementation in the practice? Patients know what to do. They don't do it. They choose poor food choices. Poor quality of foods today have limited the nutrient density of our foods, and therefore we need to fill in gaps where our diet falls short. Chronic stressful lifestyles or risk factors for disease eat up those essential nutrients, and therefore you need to have a higher commitment to supplementation. We are a population that is overfed and undernourished, and so it's necessary to look through supplementation to support quality of life factors. And today we know even something simple like a B complex, an omega, and a multivitamin can change the way your genes behave, can support longevity by helping control for risk factors at the genetic level, at the cellular level. These are the reasons why you think about supplementation. Now, what we're going to do